Okay, so let's wrap up our conversation on light therapy with just reviewing how we would work this with a patient. So remember that your setup and your application and your dosage are going to be device specific. So make sure you look at the manual and understand your particular laser. Most units have pre-programmed protocols um, based on the clinical problems being treated, so pain, muscle spasm, wound healing. So you'll have the option to use those. Um, and then you'll also be setting up a dose based on the various charts or things that we've presented in this presentation. Laser therapy should be administered in a space that prevents unintended exposure to the laser outputs. So again, our class 2 and class 3 lasers typically need training, which is what you're getting now, in order to use those devices. Again, machines are going to vary, but you almost always have a timer. You would have the frequency, and that's different. That is not the frequency of the light being produced, or that would be affected by the wavelength. Some light therapy is pulsed, just like ultrasound would be pulsed or our e-stim would be pulsed. So sometimes you can set that. For the most part, we don't do that with our devices. You would have the source, which selects the type of laser if you have multiple types that you can pick from, but usually you just have one. And then your power is going to adjust your output in watts. And so again, you usually have a typical amount that you can do for your power. And then you can either set the power, you can set the dosage, you set the treatment time. So what are effects we get in that photobiomodulation? Tissue healing, trying to stimulate tissue healing, trying to increase the strength of the tensile force of, or the tensile strength of those wounds that are healing, pain relief, things like that. Advantage, it's relatively safe. There's not many side effects. It's not producing heat, so it's athermic. So we don't have to worry about that stage. It's fairly easy to use, fairly cost effective. Disadvantages, it limits the depth of penetration. We have the risk and concern for eyesight. It's also not effective for, or as effective for individuals with darker skin, so that's a limitation. Indications, there's numerous research-wise where it's being used, but there's a lot of mixed support for that. So again, kind of activating cells into the healing mode, wound healing, pain relief, increasing the tensile strength of those scar tissues. Again, we have our 4 FDA approved. So the neck pain, shoulder pain, carpal tunnel pain, and then iliotibial band friction syndrome. But again, there's other uses beyond that. It's just the FDA hasn't approved them yet. Contraindications, we've gone through these, so we don't want to go directly into the eye. Pregnancy, and especially the uterus during pregnancy, cancers, that debate on organ transplant patients, active hemorrhaging, we wouldn't want to use it. If they have thyroid gland condition, and especially directly over the thyroid gland, and then again, mixed messages with the testicles, it should be relatively safe because it's athermic, but there's still some concern with that. Precautions, again, check with the doctor if the person is photosensitive or they're on photosensitive drugs. So again, that was tetracycline, birth control pills, antidepressants, antihistamines, and check for that sunburn, maybe up to 2 days after the treatment. If they have epilepsy, if they had a recent steroid injection or anti-inflammatory medications that they're taking, because again, it just might be counterintuitive to why we would use light therapy. And then if they have really a nasty acute infection, though we do know that the light therapy can have some effect on decreasing bacteria in the area, so it could have some benefits, but we'd want to check with the doctor. So our pre-application steps, again, evaluate the injury properly, make the good diagnosis, match your goals to the indications, check all of your contraindications, prepare the patient psychologically, so explain the procedure. You shouldn't feel any sensation. Our device has a little bit of a vibration to it, so they might feel that, but there shouldn't be any warmth or anything else. Offer to demonstrate on yourself, check those precautions, do a patient-oriented measure, so get some sort of way to measure before and after status. Prepare the patient physically, so make sure they're comfortable, remove any jewelry. Metal is fine, you don't have to remove it as far as the light affecting it, but if we're trying to treat underneath that jewelry, we'd want that removed. So it's not that the metal gets in the way, it's just we'd want to treat that, and we know that we don't get a lot of depth anyways. Position the patient so that they're comfortable, and also that we can cover the laser and make sure that the light is not going to shine in anyone's eyes. Preparing the equipment, so you might want to clean the laser lens with an approved cleaner if it looks dirty. You're going to check your manual for the average power output that your machine produces. And then you're going to calculate your treatment time based on, again, your dosage, which can come from charts or from research, your power, and your area. And then preparation for our patient, again, making sure that they are comfortable. There is some research that actually you could do some cryotherapy beforehand, which would decrease the blood flow and actually potentially help with the depth of penetration of the laser. But that's one study, so it's not necessary, but it might be something you see. You also want to clean the skin with soap and water or with alcohol swabs and make sure it's dry before we do any treatment. That will help with the penetration as well. You'd also figure out what type of application you're going to do and make sure that the area that you need to treat is exposed. So we turn it on, we figure out our dosage and set our treatment time. We would put on our goggles or cover the treatment area with a towel. We want direct contact with the skin. If we're using a large area, we'd want to use our cluster probe, or if we only have individual probes, we can do that scan or the grid. We would, again, our dosage can come from charts, research, from the manual, from the machine itself. It just kind of depends. Length of application, treatment time is going to be determined from the equation that we talked about that is based on dosage and your area and the power that your light therapy can produce. So when we go over our machine, I'll kind of show you those individual characteristics. You can do it potentially daily and as long as progress is being made. So our post steps, replace the laser, do your patient-oriented measure, so figure out how they're doing after the treatment. Give your home instructions, so any self-treatments, schedule your next treatment, their level of participation. Remind them to look for that little bit of a sunburn if you had concerned about their photosensitivity, and document. And then maintenance, we need it calibrated. Want to make sure that we get any repairs, look for the cords, making sure that they're all in good working order. Check the lens for any dirt or grime buildup and clean that with an approved cleaner if necessary.